Hello, my name's Zetta Thomelin. I'm a trustee of the Research Council of Complementary Medicine. And I'm here today talking to Dr. Carol Granger about the work of the Research Council. So, hello, Carol.
Hi, nice to talk with you today. Hi.
Thanks. So I guess our start point for this would be, why is research important to complementary and alternative medicine, CAM, as we'll be referring to it from now on?
So I think that's a really good question because evidence is really important for being able to put forward the benefits of CAM. And what we know is that a very large proportion of the population actually use CAM interventions in various ways. It might be that they go for a massage, it might be that they have reflexology, or they have acupuncture, or that they use some herbal medicine. But we know that CAM is very widely used in the population. Lots of research has actually shown that.
Mm.
And so it's actually important to show how those interventions actually have a benefit and how they work. And that's for a number of reasons. For example, if we know that a particular CAM intervention is helpful for some people, but not for others, then understanding the mechanisms by which it works is helpful, so that we can maybe improve it, or we can make sure that it's used in the right people in the right way. So that's one way of doing it. I think also establishing a body of evidence with regard to safety and compatibility, mainstream healthcare is also very important. It's very important because we know that people having medical treatment are often using CAM, but they're not often communicating to their medical practitioner that they're doing that.
Yeah.
And I think also the third reason is that it's important for CAM practitioners to establish and put forward that body of evidence to convince practitioners in mainstream healthcare that what we can provide is actually safe and helpful for their patients and not undermines it. So it's really those various reasons. It's all about, it's collecting the proof, and that's really, you can only have proper evidence if you do organised research.
Yes, Carol. I mean, working as a hypnotherapist, I see every day the efficacy of our work, but we're not going to get that widely used if we don't have the evidence to back it up. And I think that's really important, and why I wanted to get more involved in the work that you're doing. What might be different about research in CAM compared to conventional mainstream medicines?
Okay, so that's a really good question, because I actually come from sort of 20 years in mainstream health sciences. So I live that world of very tightly controlled, scientifically designed experimentation. And there are many differences between that and doing research in CAM. So first of all, most CAM therapies are actually a complex intervention. So for example, a herbal medicine prescription isn't just one single compound, it's a mixture. When somebody does a massage, there's a range of strokes that are used and a range of anatomical approaches that are used. And that's very different. So it's a complex intervention. For most CAM, it's complex interventions, which is very different to doing research on individual compounds like a new medicine for high blood pressure or a new cancer treatment. So there has to be different approaches to the research. They can be equally rigorous, can the research methods. But if you're using a single drug that's given to every patient at the same dose, at the same time, then that is a different kind of study than a study that is used to look at a complex intervention. So the first difference really is that they're mostly complex interventions. The second one is that part of CAM therapies actually involve a therapeutic relationship. And therapeutic relationships also happen in mainstream medicine in general practice. We know that that's an area that is researched, and that people respond better when they're seen by the same doctor quite often.
Yeah.
But the therapeutic relationship is very, very central to CAM. So in your work that you do, you'll know that that therapeutic relationship is really, it's part of the healing action of your therapy.
Yeah.
And it is actually in things like massage and in just about every CAM intervention, the therapeutic relationship is there, and that's a really important part of it. So researching a complex intervention in a therapeutic relationship is part of it. And I think there are also other aspects to research in CAM that make a difference as well. And partly it's because they're personalized. So it's not just that it's a complex intervention in a therapeutic relationship, it's actually personalized. So when I, as a nutrition practitioner, I might see two clients that both have breast cancer on the same day, but one of them will be given a very different nutritional plan, different diet plan than the other one, because it's personalized. And so that's another big difference. Whereas in something, going back to kind of medicine comparison, if you're giving somebody a blood pressure for a medicine for high blood pressure, they're all going to get the same medicine at the same dose at the same time.
Yeah.
So it's actually being able to do equally rigorous research, because they're both valid ways of delivering healthcare, but you can't use a randomized controlled trial that's blinded to look at massage therapy, because people know that they're having massage. Whereas if you're doing a placebo-controlled drug trial, they don't know what's in the capsule. So those are some of the differences.
Yes. It's not a one-size-fits-all approach, is it? It is this tailoring and that personal relationship and the time that you build that relationship as well, that comes into that healing process. It's exactly what you're saying there, Carol. So RCCM, how do we engage with other bodies and authorities outside CAM for the benefit of CAM, should I say?
Okay, so over the years that I've been associated with RCCM, that's actually changed a lot. And obviously our sort of starting point is that we are embedded in the world of research. And when I first became a trustee, which must be about 10 years ago now, a lot of the research that was done in CAM was actually done within universities, in departments where they had several CAM courses together. So, for example, at the University of Westminster, they had lots of different CAM courses running. And so being able to have links with the other worlds in healthcare, in mainstream healthcare and so on, was easier through universities. That tends to be less now, because there is less formal research within universities. But what is happening more is that research, and particularly things like sort of applied research, is happening more in the world of practice and also in the private colleges. So RCCM is really, we see ourselves as sort of the center of a wheel that can help to bring connections between people that are interested in research. So it could be that we can help people to recognize that, well, they've got an interest in this, and therefore there's another researcher over there that's got an interest in that, they can come together. Also, professional bodies, professional associations that represent the CAM professions, it's good for them to be able to connect together as well, because they have an interest, even though they may represent very different therapies. But also to take that body of evidence and make sure that it is communicated effectively in the right places. Now, as an organisation, we've had links over the years with people like the King's Fund, and we've done commissioned work with them before, or they commissioned us to do some work with them. We have been building relationships with, for example, the Advertising Standards Authority. We've had meetings with them, but also with NICE, which actually writes the guidelines. And that's important, because and in the meetings that we had with them, which were really excellent, they talked to us about the mechanisms that are used within NICE for CAM interventions to be considered as going into NHS practice. And we know that a few of them are, for example, acupuncture for pain. So it's partly that. We also have, through my colleague, co-chair, Dr. John Hughes, who has good connections into the parliamentary groups, that's also important. So it's making sure that we act as a sort of coordinator and conduit for this, and also helping people to identify where they might get the best benefit from the research that they want to do. And that's really one way, with the professional associations that are joining us as corporate members, to be able to help them to develop their research strategies, or to identify methodologies that they might use that other groups have found useful as well. So we don't have a laboratory, we don't have a hospital that's RCCM. We don't do the research there hands-on, but many of the trustees are involved in research in their own settings. what we do is we coordinate and bring together and build that body of evidence so that that evidence can be put forward so that CAM is more widely accessible.
And I think that's the key, isn't it? It's getting it out there, integrated
Yeah.
into the NHS. And also, as you say, people can be working away in their own little areas, bringing them together drives forward a more powerful message. So I guess that takes us to how the CAM professions benefit from our activities. Is there a bit more you want to add to that?
Yeah, I think this is the time now where we seem to be turning a corner with regard to acceptance of what we would call CAM, but also can really be seen as part of the whole sort of lifestyle medicine and self-care and mental health care. Because COVID has taught us all a lesson. It's taught us a lesson about how vulnerable we are as a society, but also how some groups within society have some health disadvantages.
Yes.
So, and CAM interventions can be really, really helpful for that. So now seems to be the point where we really should be able to move forward and have more CAM interventions, whether or not we want to call them all CAM interventions or lifestyle or mental wellness and so on, but they are all part of the kind of general body of therapies that we have within our remit. I think now is it's really a time when we can step forward with it. And I've seen it in one of the areas that I work in, which is the integrative oncology world. And I'm the director of another professional body, the British Society for Integrative Oncology, and been able to take the evidence for complementary interventions during cancer treatment and present it in a conference to 300 attendees. It shows you the power of what evidence can do and why we need it. That's really why. The more we can put into it, the more we can work together and put together our story for why these interventions really can make a difference. Not just for people that can afford to have private care, because there's lots of CAM interventions that are delivered in community groups, lots of CAM interventions delivered freely by charities, but it's actually been able to make sure that mainstream healthcare is comfortable and confident that what we can do is actually safe and helpful for their patients. So I think now the timing is really, it's with us, I think.
Yeah, this is our moment, isn't it? Sort of a reset of how the system is going to work moving forward, because it's had such an incredible shock. And people are shaken and disturbed by what they've lived through, and are reassessing how they live their lives and how they care for themselves. I think I'm noticing that certainly with the people coming to me now is, it's highlighted self-care more, and of course CAM is a part of that story, isn't it? And making
absolutely.
it accessible and understood in the wider arena out there. Well, thank you, Carol. That was really informative, and I've really enjoyed talking to you today. It's been very informative. So maybe we'll reconvene in a few months' time and see where that journey's taken us in this roadmap forward out of the pandemic, but also into a new kind of healthcare we can all hope for. Thank you.
Thank you very much.